Hello, everyone. My name is Sonia Basroy, and I'm the Director of Community with Desi Daughters. And I'm here today with Dr. Arjun Rao, who is the founder of Care Unified, also one of Desi Daughters' sponsors. And we'll be discussing the landscape and the importance of primary care both in India and the US, and how Care Unified plays a role in the caring of your loved ones. So thank you for joining us today, Dr. Rao. Did you want to give us a little introduction before we get started?
Absolutely. Thank you very much, Sonia and Desi Daughters, for having me here today. It's a pleasure to be here, and I know that we have been interacting online for a few weeks now, and hope you found that to be helpful. But I'm glad that I'm here and talking to you about primary care, and both in India and the US. Just to give you a little bit of background, I'm trained in medicine back in India. I did general surgery back in India, and then in the U.S. I worked at premier healthcare hospital systems such as Harvard and Yale and Stanford, etc. And now I'm in New York, focused on strategy and innovation at the hospital systems. In 2016, actually, I landed up taking a break from my US career and I launched Care Unified and Sync Remedies, the companies back in India, where we are focused on providing home care and elder care services for our loved ones back in India, and to ensure that they are taken care of in the most effective way. And that's been my focus since 2016. We are in the 10th year now, and we are been in existence and providing this services span across India. And we look forward to helping you and your loved ones in any way we can. So thank you.
Wonderful. So why don't we start off big by talking about what is primary care and why it's important?
So primary care, if you all remember back in India, let's start in India, primary care, which is different than primary care in the US. And so back in India, when you think about primary care, unfortunately, today in 2025, it doesn't exist as much as it used to in the 1970s and the 80s, and even in the 90s, actually, to some extent. That's when you really had the family doctor, as they called them, and the person, he or she, were the ones who were taking care of the entire family, whether it's your grandparents or whether it's or us as kids. We were all taken care of by the same physician, and he or she sometimes used to come home. We used to go to the clinic, and they used to ensure that we are doing all our screenings properly. We are taking care of our health appropriately. We are monitoring our chronic ailments, and they are also making sure that they follow up to ensure that we are doing well. That was really the model of primary care in India for the longest time. In the 90s, things changed. It became a lot more specialist driven. And slowly, what happened was everybody who did their MBBS definitely did their residency programs in specialties, cardiology or neurology or pediatrics. So, I mean, whatever. And they landed up going down that track. And now, if you go to Apollo hospitals and Fortis hospitals, you will see that predominantly it's a specialist run operation. And the mentality of people has changed. So now, if somebody has high blood pressure, they'll say, I'll go to a cardiologist. They don't say, I'll go to an internal medicine or a family doctor and find out what's really going on. That's not the mentality of all of us in India either. So what we say is that let's go to cardiology because he's the guy he's the expert in the heart and he will take care of my blood pressure. If you have diabetes, I want to go to a diabetologist, not an internal medicine doctor. So what happens now today, all of us are facing this, and definitely our parents, is that they are used to family doctor in the old times, but today there aren't that many doctors around to do family doctor type of a practice. So everybody wants to do specialization. Everybody wants to get that extra degree and go into specialization. And now we have fewer and fewer doctors who are practicing family medicine or internal medicine. And because of which, our parents face the same issue. We face the same issue back in India, where we are saying, who's coordinating our care? It is left to us to coordinate our care now. If I am having a diabetic problem, I need to go to a diabetologist. And it's just my responsibility now to talk to the diabetologist as to what the cardiologist said, which is which is definitely a hard thing to do because now we don't know medicine. Most of us don't. I mean, and therefore, how do we coordinate this? How do we understand what each of them are saying? How do we know how to take care of our ailments in the most effective way? So unfortunately, that's the state of primary care in India today. And with regard to the US, it's definitely a lot more primary care driven. Our PCP, as we call them, primary care physicians, are the core of our healthcare system, unless you have a PPO plan, which again allows you to go to your specialist if you want to without taking a referral from your primary care physician, which becomes a challenge sometimes as well, because now you're going to your cardiologist and your diabetologist and your neurologist, and the primary care physician doesn't know that. So even in the US, depending on the insurance plan that you actually have, it can vary whether your primary care physician in the US is able to manage and coordinate all these aspects of care. So primary care in its core is crucial to managing someone's preventive care and chronic ailments managing it in a way that is actually providing the right care at the right time in the right place. And primary care physicians are trained to do that. They are trained to say, okay, let's make sure that all the preventive checks are done. If you're 35 and above or 40 and above, you need to get a mammogram. Or if you're 45 and above, for men, you need to get a colonoscopy. And so all the screening tests has to be done properly. Making sure that your blood pressure is under control, you're making sure your diabetes is under control. All that is done by the primary care physician. Only and only if it is severe enough that he or she is unable to take care of it and needs advice and guidance from a specialist, that's when you're getting referred to a specialist. And that's the right model, because then what happens is that the primary care physician is at the core of the entire care being delivered and is able to coordinate that. If someone gets hospitalized, then at least the primary care physician needs to know why they got hospitalized, because they are the ones who are the repository for all your information. And that's a crucial step in delivering good, high quality care, no matter where you are, whether in India or in the US. So my strong suggestion is that if you are in India, find a primary care physician that's a family physician who's good, and in the US, definitely go to your primary care physician, because that's a crucial component of delivering high quality care here.
Oh, it's very interesting. That's a great explanation. Do you think that NRIs living in the US now are understand the importance of primary care?
I hope they do. The reason for that is the insurance here, in many, many ways, ask you to do that, right? Because if you don't have the PPO plan and you have the HMO plan or any other plan, the only way you can get medical care here from an outpatient perspective is through your primary care physician. So the system guides you towards a primary care physician. So I'm hopeful that majority of the people here recognize that they have to go to their primary care physicians. For women, it's also different, because in women that you also have a primary care physician and also a gynecologist, because it's very important that there are things that the gynecologists do which the primary care physicians don't, and therefore, especially in women's health related concerns. So it's crucial, and many women do not necessarily know that, because they may go into a gynecologist thinking that they're your primary care physicians, but they may or may not necessarily behave like a primary care physician, because gynecologists are specialists. They are not a primary care physician. So you may go to a gynecologist or an obstetrician for specific things, but it's very important that you actually have primary care as well.
Okay. And so now, so I'd like to know what the landscape of primary care in India is like, and how easy is it to find a primary care physician?
It's in India, it's definitely getting primary care physicians are harder than you expect. Definitely they are swamped. One of the biggest challenges that we have had right now is that the number of people just doing internal medicine, as they say, just doing internal medicine, even though it's a crucial component of all of this, are less than what we would have hoped for. Majority of them try to do internal medicine and then they go on to doing specialized training. And so because of which the supply and demand prevents uh, easy access to primary care physicians in India. There are definitely all major hospitals have internal medicine physicians or family doctors who are there who can definitely see you, but they are definitely swamped. And it is imperative that wherever you are able to find a good family doctor, stick with them and make sure that you go to them for all your ailments, because that's the only way you can build that relationship and build that coordination of care back in India as well. Uh, and teleconsultations have taken on in India quite a bit, and it's a lot more than the US. A lot of physicians are able to do teleconsultations for patients. Again, teleconsultations is basically what we are doing right now, which is a video call or a phone call where physicians are able to call and actually engage with patients. At the end of the day, patients in India really uh, need need to ensure that there is a way that they can coordinate their medical care in an effective way. And that's been a very huge challenge in India. All my colleagues who are now practicing in India have exactly the same problem because they are all specialists now. And they keep talking about the fact that the patients who come to them have come for them with one problem. But the situation is that they can deal with that one problem. But behind the scene, there are lots of other chronic ailments that nobody's really taking care of appropriately. The ENT guy can take care of your ENT problems, and he has no idea about taking care of your blood pressure or your diabetes. So expecting that I can go to my ENT doctor for something and then he will take care of my other things too is unrealistic. And so my suggestion and guidance to everyone is ensure that you have good primary care, no matter where you are, whether in the US or in India. And getting easy access is hard. And that's one of the reasons why I went back to India and launched Care Unified, right? Because the whole idea behind Care Unified is that coordinated care to ensure that patients have somebody to rely on to coordinate all aspects of care and have the primary care physicians who become their primary care physicians can talk to their cardiologist, can talk to their diabetologist, coordinate all aspects of care, and you're not left with holding the ball and trying to figure out how to coordinate that care. Even in the US, we don't have that. We pray that our primary care physician, the PCP, is able to do that. But many, as you know, if you call your PCP's office, you'll get an appointment after 3 weeks. You don't get your appointment immediately in the US either. And that is a challenge. Even if you want to take a teleconsultation visit in the US, it takes a while. But in India, luckily we don't have that problem because we have that easy access and we have services that can provide that easy access. But here's my caution to everyone saying, don't jump around. That happens in India all the time. People go to this doctor today and go to that doctor tomorrow. They keep moving around. And many platforms don't give you that easy access to the same physician for that continuity of care. And that's the difference between what we do and what everybody else does. We have designated doctors for you. That's your primary care doctor. If you go to your cardiologist, put them on speakerphone, and our doctor will talk to the cardiologist saying, "Oh, by the way, Arjun has high blood pressure, and this is the medications he's on. And what is your plan? What can we do? What do you want me to do when you're not around?" And that's a critical component. What do you do when the cardiologist is not around? What do you do when you can't get to Apollo hospitals or Fortis hospitals in India in a timely fashion to monitor your blood pressure on a regular basis? Who is there to support you? You can't pick up the phone and call the cardiologist. He's not taking your call. You don't even have his number. So you can't go to the hospital every time you have a problem. Somebody should be there to coordinate your care. And that's the fundamental reason why we started Care Unified. We have our care manager who's a nurse, a physician who's a internal medicine doctor, who are both available 24/7. That way you're just one phone call away to making sure that they can coordinate all aspects of your care and manage your acute problem. That means you have a problem right now, or a chronic issue, which is like diabetes or hypertension that has to be taken care of long term. So if primary care in India is tricky, easy access is hard, um, but we are there to support you.
Okay. Why don't you tell us a little bit how it works? So if someone's interested in your service, what do they do? How do they contact you?
So it's relatively very simple. You call us on our phone number, and I can share that with you and for everyone. definitely visit our website. Easy way to contact. Our phone numbers, our email address, everything is on it. You have a form, you can fill it out. The website is www.careunified.com. So careunified.com. And we'll be happy to respond to you. You can send us a WhatsApp text, and within 24 hours, somebody will get back to you. Just remember, when you send them a text, we are not in the US, we are back in India, so gives them a little bit of time to get back to you. But that's the best way to get around to doing this. Our care managers are there to support you and your loved ones.
Okay, and you are also in the business directory in Circle. And when we upload this session today, we'll add all of their contact information as well. So once someone gets a hold of a care manager, the care manager takes care of whatever the needs are. Is that right?
Absolutely.
Okay.
100%. You're 100% right. Your care manager is your single point of contact. Whether we as NRIs need to reach out to the care manager to talk about what's happening with our parents, or our parents reaching out to them saying, okay, this is what's happening, or people in India, your loved ones can also take it. It doesn't have to be only for older people. Anybody can use it. But the care manager is your single point of contact. They are available 24/7. You call them up and saying, hey, listen, I need a blood test done because my diabetologist told me to get my sugar tested. Or you can, and they will organize that for you. And they will reach out to you saying, hey, by the way, how's your blood pressure doing? You had a high blood pressure 2 days ago. What's your blood pressure today? Did you take your blood pressure, etc.? And we are able to provide that proactive approach where our care managers are constantly in touch with our loved ones and making sure that they are doing well. And the reactive way is our loved ones or us as an NRIs call the care manager and say, hey, by the way, I don't think my mom is doing that great. Can you actually go check up on her and find out what's really going on? And then we can do that. Or they need to go to a cardiologist. Can you set up an appointment? And we can set up the appointment. So it's it goes both ways. Chronic disease management is what the care manager really does, making sure that everything is taken care of and is being monitored proactively. And from a reactive perspective, whether it's an emergency, we can deploy ambulances anywhere in India. We have connections with hospitals across India, so we can get your loved ones to hospitals in most major cities in a timely fashion to take care of them. And that's in the emergency care. And also, if somebody wakes up and they have a bad headache and not feeling too well and they have a fever, they can call our physician and within a phone call away, and they will prescribe medicines, we'll deliver the medications to you and get it done. So whether you need nursing care or caretakers or physiotherapy, medical equipment like wheelchairs, etc., all of that, we take care of it all in the comfort of your home.
Sounds amazing. Wish we had something like that here.
And I wish we had something like this in the US. I think I think we all are looking forward to having something like this. Right.
Well, Dr. Rao, this has been a real pleasure. So educational. Thank you so much. Like I said, we will have all of your contact information along with this session. And Dr. Rao is very active in the group, so can reach out and ask questions and he'll respond, I'm sure.
Absolutely. Happy to do
Yeah.
that. And please reach out if you have any other questions. And definitely, I've been in the US and in India for a long period of time, so I'll be happy to cross that bridge and provide any guidance that people want about healthcare in the US or healthcare in India. So happy to do that.
Very important. Thank you again.
Thank you very much. Thanks for the opportunity. Take care.